How do parents pass on the sickle cell gene to children? Imagine a family where some members carry a special gene that can affect their health in a unique way. This gene is responsible for producing a type of hemoglobin, the protein in red blood cells that carries oxygen. Everyone has two copies of this gene, one inherited from each parent. The normal gene is called A, and the gene for sickle hemoglobin is called S. When a person inherits two sickle genes, one from each parent, they develop sickle cell disease. This disease causes red blood cells to become shaped like crescents or sickles, which can block blood flow and cause health problems. If both parents carry one normal gene and one sickle gene, they are said to have sickle cell trait. This means they usually do not have symptoms but can pass the gene to their children. Each child has a 1 in 4 chance of inheriting two normal genes, which means they do not have sickle cell trait or disease. There is a 1 in 2 chance the child will inherit one normal gene and one sickle gene, making them a carrier with sickle cell trait. And there is a 1 in 4 chance the child will inherit two sickle genes, resulting in sickle cell disease. Now, if one parent has sickle cell trait and the other parent has a different abnormal hemoglobin gene, such as hemoglobin C, their children could inherit a form of sickle cell disease caused by a combination of these genes. For example, inheriting one sickle gene and one hemoglobin C gene can cause a condition called SC disease, which also affects red blood cells. When a parent has sickle cell disease, meaning they have two sickle genes, they can only pass on the sickle gene to their children. The child's risk depends on what the other parent carries. If the other parent also has sickle cell trait, there is a chance the child will have sickle cell disease. If the other parent has normal genes, the child will be a carrier but not affected by the disease. Sickle cell disease is inherited in an autosomal recessive pattern. This means a child must inherit two sickle hemoglobin genes, one from each parent, to have the disease. Parents who carry only one sickle gene usually do not have symptoms but can pass the gene to their children. That's why genetic testing of both parents is so important to understand the risk of passing on sickle cell disease. This pattern of inheritance explains why sickle cell disease often appears in families and why genetic counseling and screening are recommended, especially in populations where the sickle cell gene is more common. If you're planning a family or are concerned about your genetic risk, talking with a healthcare professional or a genetic counselor can provide personalized guidance. Remember, understanding your genetic makeup helps you make informed decisions about your health and your family's future.